So I wanted to come on and talk about a general practice topic, which is herpes. Big one. So the herpes virus, so in particular the herpes simplex virus type 1 and type 2. So traditionally herpes simplex virus, so I'm just going to call it HSV for short. HSV1 is typically the virus that we would associate with cold sores, oral cold sores. And HSV2 is typically the virus that we would associate with genital herpes in men or women. So they are like little sores that can be stinging and burning and a bit sore, and they can really present anywhere on that sort of mucosal surface of the genital region. But we do know that there is a bit of interchangeability. So sometimes we might find HSV2 on the lips, and sometimes we might find HSV1 on the mucosa in the genital region. So they can, mix around. So for all intents and purposes, it's HSV, doesn't matter 1 or 2. We treat it the same depending on the location and the severity of it. Now, it's a really tricky virus. Actually, it's like the most interesting viruses of all, I would say, maybe until we had COVID for me, because you don't necessarily have had exposure recently for you to have had an outbreak. So what does that mean? That means, example, you could have been exposed to the virus as a child. If I did your blood test, it would say that you've had this virus, or at least it's come through your system, but you would have no evidence or any case where you've actually had a infection. So you would never have had the sores on either genitals or, the mucosal or the mouth. So it's really interesting. So that's why you can't necessarily always do a blood test to determine if somebody has got the virus or not, because it doesn't actually quite match up with the clinical context. Likewise, I have had patients, for example, I've had an 85-year-old female who's come in with genital herpes, and she has not been sexually active for over 10 years because her husband died over 10 years prior, and she swore black and blue she'd not had sex since then, and I believed her. So she would have been exposed to that virus at some point when she was sexually active years and years and years prior, probably was just there in her body, never had a case of it clinically in the mucosa until her immune system started to not be as good, and then bam, she got it. So it's a bit of a shock, and that can happen. Now, what do we do about it? So if it's the oral cold sore virus, you can use topical agents like Sevirax. You can use medicated over-the-counter antiviral treatments for a couple of days. If it is your first case of genital outbreak, we would normally treat that with antivirals that you need a prescription from the GP. And then there are people who have chronic outbreaks, so they have outbreak after outbreak, and they need suppressive therapy that goes on for like 6 months or more. Now, of course, this is just very, very general. You need to see your GP, see your doctor if you have any concerns. This changes depending on your immune system. So if you're immunocompromised, if you have got HIV, or if you've got any other immune, modulating disorder, or you're on medications like prednisone or methotrexate, or if you're a child, these things completely change. The treatment processes change. But yes, it's a very interesting virus. I just wanted to give my 2 cents about it because it comes up quite a lot in general practice, and it's very confusing for a lot of people. A lot of people really freak out, but you don't need to freak out. If you've got the symptoms, you get treated. If you don't worry, no need for blood tests.